The floor is yours.
Thank you, James, for all of your help, and thanks, Ray. Denise, I'm just doing a count on my end. Are we doing okay with a quorum?
No, we only have 6
Okay.
and we would need 7. So if there's someone else that's going to pop in, in the next couple minutes, we'll be okay.
Okay, we might hold our one action item then. If you want to let me know when we have 7, we might
Okay.
hold that one action item until we have a quorum then.
Okay,
We'd like to.
we'll probably
Yep.
have to save the minutes too, Dr. Wagner.
Yeah, I did just
Okay.
really quickly with the minutes before we get started. There is a typo that I noticed. The top of the minutes say February 21st, and it was actually on February 12th.
Thank you.
So we will just want to get that corrected. But
Okay.
okay, we would like to welcome you out to the UETN board meeting this morning. I believe it's a lovely spring day in all of the state of Utah. So I hope that you're able to enjoy that today and this weekend. Thank you very much for being here. As we just said, we are waiting to make sure that we have enough members of the board to vote and do action items. So we will hold on the minutes and our one action item until Denise tells me that we get to that point. Just by way of introductions, though, we have Matt McCullough on the call here, and I believe that we should now be referring to him as Dr. Matt. Is that correct?
Thanks, Dr. Wagner. Just about. I'm just waiting for approval of my dissertation, but I successfully defended, so it feels good.
Well, congratulations. We are an education institution, so we want to note those significant achievements. So again, congratulations, and that is a great achievement.
Dr. Wagner, we have
yes.
7. We have 7 now. Brittany has joined.
Okay, great. You have access to the minutes from our last meeting. The one correction that does need to be made, if you look them over there, was just a slight typo at the top. The meeting was actually held on February 12th and not February 21st. So I would entertain a motion from the board to approve the minutes with that slight change.
So moved.
Thank you. Is there a second?
Thank
you, Scott. All in favor, please raise your hand. Any opposed? Thank you very much. The minutes stand approved. We have one action item this morning, and that will be an addition to the UTN Advisory Council. Matt, would you like to tell us a little bit about this individual before we vote?
Yes, I'd be happy to. So as you know, on the advisory council, we have a number of categories. One of them is organizations from a rural area. And previously, Locke Ettinger was on the advisory council. He was working with Southern Utah University in the Utah Rural Health Association. Locke has retired, and we are asking the board to fill his position with Casey Shakespeare, who is also with the Rural Health Association of Utah. And Casey is great to work with. He leads 2 different HRSA grants for opioid and substance use disorder treatment using telehealth. So he's familiar with telehealth, and we think he'll be a great addition to the board, the advisory council.
Great. So then the action before the board is to appoint Casey Shakespeare to the UTN Advisory Council. Is there a motion to that effect?
So moved.
Thank you, Steve. Is there a second?
Second.
Thank you, Ben. Any discussion or questions? Okay, all in favor, please raise your hand. And any opposed? Thank you very much. The motion passes. We'll now go to our discussion items, and we'll first have our executive director's report. Ray.
All right. Thank you. First thing I want to share with you is the outcome of the most recent legislative session. As you know, we weren't the only state agency that was hit hard during the multiple special sessions and had our budgets cut. But it was significant for us, and so we were concerned about that. When the revenue projections came in, the economy looked good for the state of Utah, and so the legislature in the last session went ahead and reinstated our budget cuts. So you can see that that was priority one. They fully reinstated that. We did have some projects that we were able to pay for through the CARES Act funds. And so we did not ask for that as a reinstatement from the cuts. We did not want to double dip there, but the legislature did come through for us. Our second priority was to fund growth and operations. And on every year on average, we have 25 new locations that need to be connected to our network. And these would be new schools, these would be district offices, new clinics, things such as that, where we need to get them connected. And that's what we consider to be growth. And we have typically had that funded every single year, no questions asked. And we provide a list of those locations at least a year in advance to the legislature to receive that ongoing funding. For some reason, I don't know why, but our growth and operations was not funded. So we have a couple of options here. One is that would become our first priority in this next session. Or the other one would be some of the new monies that's coming in to the state, seeing if we can tap into some of that to help fund these locations to be connected and upgraded. So that is a concern that I have. Let me stop sharing now. All right. Some of that funding that leads me on to talk a little bit about the American Rescue Plan Act. You've heard about this, about it being the $1.9 trillion. Well, if you take that 1.9 trillion and you look at some of the other pots of money that have been announced, it could be anywhere as, added all together, it's as much as $2.3 trillion. Of the 1.9 trillion, we've been told by the Governor's Office of Planning and Budget that Utah will be receiving 1.5 billion into our state. So that's significant funding coming to us. Once that money arrives, the legislature will go into a special session and decide where to allocate the funds. As we're watching it, we have three areas of specific interest, and it would be obviously our stakeholder areas. The K-12. Nationally, K-12 is going to receive 125 billion. Higher education will be receiving nearly 90 billion. And then the other area that we're watching very carefully on this is in the healthcare area. The things that we're looking at would be school-based telehealth services, mental behavioral health access, home health, including emergency medical support or services, remote patient monitoring, and HIPAA compliant telehealth platforms. So those are all things that we're looking at, and we're watching as the funding is announced and the guidelines are more clearly announced on that. So we were approached by, again, the Governor's Office of Planning and Budget, and asked, similar to what we did with the CARES Act, to put together a submission, put together a plan. And we've done that. We had 3 days in which to assemble everything together. And so what we did is I had my leadership team come together. We reviewed some potential areas that we knew that we weren't able to fund with CARES Act monies because of the lack of time to complete the projects. So we had a listing of some of those projects that were very worthy of being funded and essential, we thought, but we simply didn't have the timeline. So that became the first thing that we were able to do. Then we took it to our managers, shared with them, and then they took it to the other staff members, and everyone had an opportunity to put ideas forward. We gave it our best shot overall, and we used the same four pillars that we did with the CARES Act monies. We looked at infrastructure, we looked at tools, we looked at training, and then we looked at access. And so those are the 4 areas that we identified. And then underneath each of those areas, we had multiple examples and that we were able to provide. And we were pretty general in what we submitted, and letting them know that if they need any specifics, we can drill right on down to some very specific items that we're talking about, and where we got the funding request on that. The access area is one that's been really difficult, as we have learned through the pandemic. We take great pride in the fact that almost 100% of our schools are connected, very well connected to the statewide network. We're still working down to Navajo Mountain and down in the San Juan area. But as far as our responsibility given to us by the legislature to connect schools, we are one of the envies in the nation on how well connected we are. But when you have a lockdown and students aren't at the school, it becomes problematic. And so you start looking for different ways to provide that access. I would like to remind you about our December 9th board meeting. We had board member Long and our CTO, Jim Stewart, present to the board and talk about spectrum, and talk about a lot of the different ways that we are looking at potentially being able to connect families that don't have any internet services to their home. And we're not talking just about the most remote areas of the state. Some of our most remote areas are the most well connected. We have some of our school districts, inner city school districts, where there are many students who did not have access to school content and materials and instruction. And that's something we need to rectify. We need to be able to move forward and be able to provide those kinds of services that they need. We're not talking about providing internet to the home where they can surf the net, where they can watch Netflix or Hulu or whatever. That's not what we're talking about. We're talking about school content. And I like the way that San Juan School District describes it. They say we're taking this, we're not taking the internet to the home, we're taking the school to the home. And I think that's the real difference of what we're talking about, is for a school district to be able to support those families that they either live in an area where there is no signal, there's no service provided, there's no way they could sign up for anything, or they simply don't have the means to pay for it. Now there's talk through the Shelby Coalition that we're a member of. That's schools, healthcare, libraries, and broadband is what Shelby stands for. And there's talk there, and we've been quite influential in working with the FCC and reviewing the E-rate program and asking and petitioning if we would be able to use E-rate funding to help cover the costs of connecting some of these homes. So that's something that's coming forth during the emergency time frame. That is, we're waiting for guidelines on that to see what that would entail. So what Dave and Jim shared with us in December were some examples of school districts that are already part of a pilot that UETN has been supporting. We started out with the intent of having 4 districts be able to join in on this pilot, and we now are up to 25 that see a real need in their areas. We have Murray, we have Ogden, we have Wasatch, Beaver, Millard. You know, a lot of these just different needs, a lot of differences there. The initial intent of our pilot was to see if we could provide ubiquitous connectivity throughout the campus, in the classroom, in the hallways, in the commons areas of the building, out in the parking lots, on the playing fields, anywhere within the boundaries of that school campus would we be able to provide that connectivity. But it's gone beyond just the entire campus. It's gone that there's a need to move forward to the home for many of our students. So the reason I bring this up is it's not an action item, but I'm planting the seed in your mind to think about this, and we will be sending additional materials out. And if we were to take advantage of the E-rate program and use funds to help connect to the home, or actually it says in the wording, it says not in the school or not in a public library, provide that connectivity for those students to access school-related materials. That's a change in our mission. And that's not a decision that I make. It's not a decision that my leadership team makes. The board sets the direction for UETN. That's your role and responsibility. Our role and responsibility is to handle the day-to-day operational responsibilities. And so I'd like to put this as an agenda item in our next meeting. I would like to have it be an action item and get some direction from the board on whether you feel that this is an area that we should, a direction we should be heading. Now, one thing that concerns me that I want to make sure that we fully understand is we have had a wonderful working relationship with our telecommunication partners. Over the years, as we have put out the RFPs, they have responded. They've been very generous with us. When we lay out in the RFP what we need, we describe the location, we describe the purpose. They in turn take their pencils and sharpen them, and they figure out the very best rates that they can for us. And they submit those bids, and it's a very competitive process. And then we have a way of reviewing all of the responses, and then we make the awards. we need to make sure that in those areas where they have expertise, that we involve them, that we don't shut them out, that we include them, and that we're very clear when we put out our RFPs, that we very clearly state what we're going to be using that circuit for, so that they know and that they can develop their proposals in such a way that they cover their costs, and that they're able to support us, and that we're able to provide and meet the needs of our students. So that's just mainly an information item for you, again, talking about that connectivity component. And I'd like to have that, again, be a discussion item in our next board meeting, and also as an action item. That's really, Dr. Wagner, that would be my report. I'm open to any questions that anyone may have.
This is Scott. I have one question. Would that also be applicable for telehealth services? We have the same troubles that students have accessing our patients. You know, we've worked with Matt's office on getting the new ambulatory system for telehealth in our clinics. Could the same thing be used to help patients access telehealth? Because we're having a lot of problems. We can provide the service here, but we're having a hard time with some of our patients' homes.
I mean, you're one of our stakeholders, and so our role is to provide the support that you need so that you can accomplish your mission. That's why UETN exists. We're not here to build our kingdom and that. We're here to support our stakeholders and help you be successful in accomplishing your mission. So if that's part of it, yes, we would be doing that. Again, though, very clearly, working with our telecommunication partners and making sure that we are being fair to them, that we don't put out an RFP and then get their bids and then we change the way that we're going to use the circuit. No, they need to very clearly understand what it is that we're going to be using that for, and we need to be working collaboratively together with them.
I understand that. I'm just wondering if, because it's going to be a closed circuit, not access to all of the net, which would help them. People aren't watching Netflix and stuff on this, but if we could add that same, program that was purchased by UETN to support telehealth, we could restrict it to that program. It might be just as beneficial and have a broader application for our areas.
Yeah, that's a great point. Thank you, Scott.
I do want to be. I want to make sure that Ray, if in our next meeting, this is both a discussion item as well as an action. It's pretty significant topic for the board. I'd love to reach out to members of the board. Are there things you would like Ray and the team to bring back that you would like to see or discuss or understand before we take any action? For example, do you want specific examples, or are there things that you would like to see? Is there some direction that we can give Ray prior to our next meeting, when this would be proposed to be an action item that would help us as a board to make an informed decision? Any thoughts?
I think it'd be nice to come back with a plan as to how we can still keep a good relationship with the telco providers. I mean, that's part of the strength of the Utah Education Network, is that partnership, and still infuse new technology to get last mile connectivity, and just how that might work out. Because I don't think it's an option to bypass them, but I don't think it's an option to bypass or to ignore new technologies and how they might benefit in connecting homes. So I think to the extent that could be talked through with the telcos, maybe you have the telcos help them to understand maybe they could use some new technologies and help and assist them. But for the Utah Education Network to go ahead and bypass all telcos to get the homes, I think is problematic, as it is problematic not to use the new technologies that are coming forward. And I think if you reach out to them with that kind of partnership agreement, I think it'll be strengthened and not weakened. And I think some proposal towards that end would be good.
Dr. Wagner, one thing I said is for it to be an action item. If it takes more time, I don't want to rush this, but at the same time, we do need to have some direction on where we're going. And that's why I suggested that it be an action item, but perhaps it may end up going to the, to another board meeting beyond that.
Okay, other thoughts, directions from the board, things that we can give Ray that we would be interested in looking at or discussing on this topic?
I have a related question.
Please.
Thank you. So similar to the question that was just recently asked, I think it would be helpful to know, if not UETN, then who? So the problem is identified, the gap has been identified. If UETN doesn't fill this gap, who could or would or should, and is it, does UETN provide the most cost-effective solution, et cetera? And so it's just that balance of if UETN doesn't step in and fill this, is there somebody else who could or would or should other than UETNs?
Okay, that's a good question. We'll see what information we can find for you on that.
I think another issue is, what will it be like in the fall? Is it going to be different? Or I know there's going to be a new normal, but will the criticality of last mile connectivity be as important if everybody's back face to face? That's another issue or variable in all of this that would need to be discussed.
And I just had a quick comment. Ray, thank you for the representing this issue so well and the challenges we're facing in the state with it. That's a great synopsis you gave leading into this. I've been reading the FCC request for comments. Rick Gaisford had sent out a link to the tech directors to add comment to that. And so I've been going through that. And the thing that stood out to me on this last mile issue is they're really looking for the long-term solution. And that's going to take some serious partnerships to make that happen, because they're referring to the homeless in this. And how do we reach that, not just the home, how do you reach that student, that patron of the library, the person in telehealth? And they're mentioning all of those that doesn't have a home location but needs connection.
Ray, as far as timing goes, you had referenced this fall. If we were to have a discussion in our next meeting, which would be June, and not take action until the following, that would be the end of the summer, and that would be pushing up close to fall. What kind of urgency are we talking about here as far as you and your team needing direction from this board? Is the urgency such that the June meeting would be best, or could an August meeting, could an action be taken then? Do you want to give us your thoughts?
Yes. It's districts are already doing this. They're already moving forward. And like I said, we started out with as a pilot. And as other districts have seen the progress that some are making, they're wanting to do it as well. And so in reality, what it would be for the board to say, yes, you know, we approve you moving forward with this. And because there are some that question whether or not we should be doing this at all, whether someone else should be doing it, as board member Cummings mentioned. It would just be nice to have the assurance of the board that it's okay for us to do what we're trying to do.
Okay. Well, it sounds like you have received some direction then on information the board would like to see at our next meeting. Unless there are any verbal objections from the board, I would say we go forward with this as a discussion item and as an action item for our June meeting. If for some reason we have to table that action, we can, but try our best to get some direction to the team as quickly as possible. Does that sound okay? Okay, great.
All right, thank you.
Ray, okay, Ray, anything else?
No, that would be it. Thanks.
Okay, we'll go on to our advisory council reports now. We'll start with the UTN advisory council, and Matt, please.
Okay, thank you. So we had a great meeting. A few things to update the board about. Our advisory council chair, Sarah Woolsey, has taken a new full-time position with the Utah Department of Health, and she announced that she would be stepping down as our chair. And similar, our vice chair, Preston Marks, has also taken on more responsibility with other boards and commissions and asked to remain on the advisory council but step down as the vice chair. And so at our meeting a few weeks ago, we had the advisory council select a new chair and vice chair for this coming year. And I wanted to report to the board. Zoe Robbins from the University of Utah College of Nursing was selected to be the chair for this coming year. And based on the outcome of the meeting today, Casey Shakespeare from Southern Utah University will serve as the vice chair. And those are one-year terms, so we'll revisit that a year from now. Since that's voted on within the advisory council, we just wanted to make the board aware that those two individuals were approved to serve in those capacities. Let me see real quick my meeting minutes. I wanted to share some recent legislation, and it's not surprising, but all the recent legislation related to telehealth was specific to mental health services. And so Scott, I'm glad you're here today because this is right up your alley with mental health services. There was a Senate Bill 41 sponsored by Senator Escamilla, was related to coverage parity for mental health services. So it requires insurers, if they cover in-person mental health services, they also have to cover those same services through telehealth and meet the same standards of care. So that was a big step forward. Senate Bill 161 was sponsored by Senator Weiler, and it did a lot. This is a very comprehensive bill, but two things. It requires mental health services to be reimbursed at a negotiated commercially reasonable rate. The original bill actually stated that it would require parity, so equal payment for in-person or telehealth, but there was pushback from the insurers, is what I understand. So they allowed the insurers to keep their own negotiated rate, which right now most insurers are paying in-person rates during the pandemic, but once the public health emergency ends, they'll probably pay a little bit less for the telehealth visits. Another important thing on Senate Bill 161 is it allows providers to use any telehealth technology that is HIPAA compliant. And the reason that's important is in other states, we've seen cases where insurance companies will actually purchase their own telehealth platform and require providers to use that platform in order to be reimbursed for the service. So this is a really big step forward for Utah because it allows providers to use any platform as long as it's HIPAA compliant, and it doesn't restrict them to using the payer's platform. So it was very good foresight by the state to put this into the bill and make that possible. Three others that were all kind of related: Senate Bill 47, Senate Bill 155, and 53 were all related to EMS, so emergency medical services, and mental health. Senate Bill 53 creates a new license for behavioral emergency service technicians. And so this is another really important bill because if you have EMS, paramedics going out and responding to calls that are specific to mental health crises, they're actually going to create a new license or certification for those responders to be trained in mental health services and mental health crisis services. So we've been talking with the Bureau of EMS at the Department of Health about how they can build in telehealth technology into those services, but also in the training curriculum for these EMS providers. So they're not just learning about mental health, but also how to do mental health services over telehealth. And there's a lot of excitement about using this technology. Similar, even at the federal level, Representative Curtis has a draft bill right now that requires Medicare to cover telehealth for substance use disorder treatment. So that hasn't been presented yet, but we've seen a draft of that bill. So I just want to share that all of the telehealth related legislation right now is mental health specific. It's expanding access to mental health services and substance use disorder treatment over telehealth. So that's good to see. Utah really needs it. There's a huge shortage of mental health providers in the state, and using telehealth to provide these services to patients in hard to reach areas is vital. Let me just see, Scott, if you have any thoughts on any of those or want to make a comment.
No, I followed those bills and I was excited about them. I wish they would have done something to increase access. Just it's what we've been talking about is that it sounds good, but then if the internet's not, viable in the rural frontier areas, then the sessions are difficult. I've done some myself, and it's a challenge when you freeze up all the time. So it's a step in the right direction for sure. All of those I thought were good changes.
Yeah, so tagging on to what you said, Scott, my next comment that we talked about in the advisory council meeting was access. There's two big federal programs right now focused on expanding access. The first one is the Emergency Broadband Program, which you're probably already familiar with because it relates to education as well. But what it does is it provides a $50 monthly subsidy for households to be able to access the internet. It also pays a $75 monthly subsidy if they're on tribal lands. And then there's a $100 subsidy for purchasing a device. And the students or patients in this case have to work with the local telecommunication companies to apply for this program. The only downside in my mind is that it is short term. Once the funding is expended, the household has to start covering the cost for that internet access. So if cost is the barrier, it only is going to help for so long. But I think back to Steve's comment about how long will this be required to be able to do school from home and do telehealth or healthcare appointments from home. So I think the purpose of this program is to get us through this public health emergency, but we'll see what the impact is once it ends. The only other funding opportunity that's just opening up right now is called the FCC COVID-19 Telehealth Program. There's $250 million appropriated. This is actually round 2 because they did the same program in the spring of last year. But this applies to both healthcare sites, hospitals, and clinics who want to help connect with their patients remotely. And so they can apply for internet circuits, they can apply for the hardware needed, they can use the funding for telemedicine software or hardware, peripheral devices. The only caveat to me is that it's super competitive. There was 200 million last year and there was 650 million of requests. And so they had to prioritize based on the areas that were hardest hit from COVID. And Utah was not one of those, if you look nationally. And so it's very competitive, and the application window is only 7 days. So applications are going to have to be put together quickly. So those were 2 other updates we talked about as a advisory council and how we can help spread the word about these funding programs to organizations that may need them. A lot of other updates were given about mental and behavioral health services, as I touched on, rural community outreach and training. And lastly, we covered a few things about our federal grant, the NRTRC. Our annual conference is coming up April 21st and 22nd. It's being held virtually again this year. But we're about ready. It looks like a great conference. Ray is actually going to speak about the UETN network, and we have a number of panels on telehealth best practices and supporting patients and providers during this time. And so I think that is all that I have as a summary of our advisory council meeting. Any questions?
Thank you, Matt. Appreciate the work of the UTN Advisory Council as well as your leadership. We will move on to the UEN Advisory Council report now. Rick, please.
Thank you, Dr. Wagner. Appreciate this time. The Education Advisory Council met last Friday, and we basically covered 3 topics: EduRoam, filtering, and the statewide technology inventory. Thought I would just give you a brief recap of the discussion in each of those. On EduRoam, which is the wireless protocol for students and administrators and teachers and researchers to be able to access the internet in other institutions and other locations. As simply as just opening up your computer or turning on your device and you're automatically connected. It is a great resource, and our presentation last week was really just an update on how we're trying to expand the use of EduRoam throughout the state. Scott McCombs from Canyon School District shared how he has been working with both the county government and several of the municipal governments in the Canyon School District to working with them to see if they would be willing, and they are, to adding the EduRoam protocol to their wireless access. So If you are in a public building, city hall, or even in a park, or any kind of a county building, that Edge of Rome protocol would be there. So, and going back to Dr. Timothy's point about access, this is certainly one avenue or one way to help, with that access for students by letting them know locations that are that are in their community where they might be able to access the Edge of Rome wireless network. They've also printed off some stickers and some placards or whatever that could go into other institutions or businesses and that would be willing to add that protocol. The nice thing about this is that particularly for K-12 students, this provides them filtered access. So again, it's that taking the classroom to their location, wherever that location might be, or their school resources. It's not just open access, to the complete internet and that. But it is growing. There on the link in your agenda, you have a link to the advisory council agenda from last week, with a link to the Edge of Rome page at UEN. I think it'd be worth your time, if you haven't taken a look at it, to go and to look at that. Another that Jim Stewart shared was that I think it's now on the Front Runner. So if you take Front Runner, you have access to Edge of Rome. So that's really this idea, is to really make this a protocol that for students and for educators at all levels to be able to always have access in these in varied locations, including schools and district offices and libraries, and I would see this in a variety of other places. But it is being very successfully adopted now, I think, throughout the state. And there's sort of shows you what you can there's a map there that you can drill down and see all of the locations of participating sites in Utah. So that was the first item that we discussed. The second item we talked about was it's just everybody's favorite topic of filtering. And
Sorry.
well, I couldn't agree more. For as long as I have been at the State Board of Education, filtering has been a topic. From almost the very first meeting I attended, had something to do with filter. UEN has been a phenomenally good partner in helping schools to make sure that internet access to students is as safe as we can possibly make it. That said, there is no perfect filtering solution, and there never will be. And the technology today only seems to increase the complexity of the work that needs to be done. For the last number of years, UEN has had a contract with iBoss as a statewide filtering solution. iBoss is one of multiple companies that are out there that offer this kind of service. This last year, with the CARES Act funding, we moved everybody from an appliance-based use of iBoss, where there's an actual physical box at various sites and districts and that help with the filtering, to the cloud solution. It was a good transition, and but our contract with iBoss does expire the end of in June of next year, June of 2022. And so UEN has put together a filtering committee to go through a full RFP process to select select a filtering provider for the coming 3 to 5 years post contract award. This committee is now meeting monthly, weekly, and they just recently released the RFI out there. They want to first survey the landscape to see what kind of solutions are out there. Certainly, we are aware of a number of those that are already being used in districts around the state. iBoss is by far the predominant filtering provider because UEN does pay for the cost for that. But there are LEAs around the state that have selected a provider of their own, such as Go Guardian, and now the other one just left my mind, but there are those others out there. So right now the RFI is out, and we are receiving we're receiving those from companies and that may be interested. I can tell you that it is reaching out far and wide. People are aware of what we are trying to do, and in fact, I had an email exchange with someone from the Canadian consulate in Denver, wanting to be able to make sure that some of the Canadian companies would be able to potentially be, in the mix, being able to participate in that. So this committee, the committee that is meeting is going through and establishing all of the review criteria, and then they will be going through the RFP process, and they will be doing the demonstrations, and then through that, sometime in the next, between now and probably early next year, they will establish who that, on the timeline, who the contract will be awarded to. But again, that is to help us in that most essential role of making sure that the content, particularly for K-12 students, is filtered and safe, and that we can at least eliminate as many of the big areas that are problematic, so that they cannot students cannot access that kind of material. And again, that filtering does extend out to the Eduroam system for K-12 students, as that is all routed back through the district that they reside in. So that was the network filtering. And then the last one that we had a presentation on is an update on the Utah School Technology Inventory. This was an outgrowth from the Digital Teaching and Learning Program from the very, very beginning, when UEN received $5 million to conduct an inventory of all technology in schools statewide, along with an engineering study, and that UEN was able to leverage those funds and be able to do the inventory, the first 3 inventories, basically from some of those funds in that. So we started with the first inventory in 2015. This was before the Digital Teaching and Learning Program was approved in 2016. And it gave us a great baseline of information of how much technology was in, and then that helped us to be able to show the impact of the Digital Teaching and Learning Program, not only the funds that the state provided, but also the funds that local LEAs put into digital teaching and learning as well. When we started the program in 2000, or the inventory in 2015, at that point we had, I think, right around 350,000 devices for students around the state in all the schools. Some of those obviously were going home with students, but probably about 98% or more were just in school, in carts, in classrooms, computer labs. And when we did the last inventory was done in the fall of 2019. I think that's an important date to keep in mind, that inventory was conducted about 3 months before concluded about 3 months prior to the school closure. And I'll come back and address that in just a moment. But in 2019, we had over 700,000 devices for students, and in the state. So in a period of just 4 years, we had more than doubled the amount of devices to students. I think what's going to be interesting going forward, and that is that UEN has been able to secure the contract again with Connected Nation to be able to do the next inventory, which will be this fall, beginning in October and being concluded in December. I think of note here is that this inventory will be done just a few months after the pandemic has hopefully passed. So we are going to be, I think, one of the very few states in the country that is going to have data prior to and just after about the impact of, which we'll be able to, I think, to see some of the impact of the funding that has become available to districts and schools. One of the things that we are going to include in this new inventory this year is home access. We're trying to figure out what the questions are. So if you have good ideas of things that data elements that we should be looking at, I think that would be much appreciated, because we really do want to be able to capture the home access and this gap, and see how, from this information, how we might best be able to then fill that gap. It's sometimes called the homework gap. It's the access gap. But what we do know is that we have, as we enter this, this new normal going forward with technology, what we do know is that students are still going to have access. Although they may be in person in school every day of the school year, their teachers have adapted and learned how to use technology resources that are going to have, for so many students they will still need that access at home to be able to have that complete, well-rounded education that we would like to, that we strive to provide. So that's where we're at with the technology inventory, is that it will be again conducted this fall, and we're working on it now with Connected Nation to set up the portal. Well, the portal's already there. It's just really, designing the questions that we want to ask this year, particularly questions that will help us to capture some of what has happened over the last year and a half. When we get to that, we'd be about a year and a half when we start the inventory, since the pandemic really began. But I think it'll be really insightful to be able to see the data that we'll be able to get back from that. That pretty much is everything that we conducted. We also just had a couple of the committee reports from the couple of the committees that report to the advisory council, but nothing of note there. And that's my report. Unless there's questions.
Yep. Thank you, Rick. Any questions for Rick? Great. Thank you for the work of the UEN Advisory Council, Rick, and for your efforts. I was thinking, since it is the role of both of our advisory councils to advise the board, I'm wondering, Ray, Rick, and Matt, if it would be good prior to our next meeting and the discussion and potential action item on the access piece, if there's anything that the two advisory councils can share with the board, or that they would like us to know about or think about. Perhaps Matt and Rick, you can coordinate with Ray, and the board can receive that information. Does that sound good?
It sounds like a great suggestion. I think we have our agenda, Laura, for our next meeting. So, we usually typically meet 1 to 2 weeks prior to the board, so we will take that as a discussion point and submit that information to the board, so you'll have that prior to your next board meeting.
That would be great. Thanks. We will move on to our last discussion item now, and Laura is going to lead a discussion on policy review.
I am. Thanks, Robert. So this is time for some spring cleaning on the policies that we have, that the board has adopted. So you'll see there's 5 policies in your board materials, and this is a discussion only. We're not planning to take action until you're ready, at least at the next meeting or even after that. The staff has reviewed these and is recommending that we eliminate the first 2, the acceptable use policy and the voice over IP policy. They are very out of date. And if you had a chance to skim through those, you'll know exactly what I'm talking about. For example, in the acceptable use policy, it talks about us providing internet service only for secondary schools, and we stopped doing that long ago. So we're planning, or we're recommending, to eliminate those first two, and then the other ones really just need to be updated. There's a couple things in the bylaws, for example, that we have learned since the bylaws have been in effect for about 5 years. The diversity policy we're required to review and update annually. And then the video recorded courses and events policy is about 5 years old and needs to be refreshed based on some of the new technology and options. So this is a discussion item if there is information you want to share now. And then I'd also really welcome if any of you are into policy and would like to help with reviews or providing some feedback before the board meets next time, that would be great. And you could reach out to Robert or to me if you have ideas for that.
Hey, Laura, this is Greg at Davis Tech. Did you say you're going to eliminate the acceptable use policy?
The current policy, yes, it's probably about 10 years old and quite out of date. So that's a question that we have for you. Since then, the board has adopted a really comprehensive terms and conditions policy that I think is about 2 years old. That's much more current. And it's worth looking. There's a link to all of the policies in the board materials. And it's not saying that we don't want to have acceptable use. It's just that the way it's written currently is not as we're practicing now.
So would you say that policies can be replaced by the terms and conditions policy then?
That's the staff recommendation, but again, that's for board input. And we also, just so you're aware, we also have the attorneys take a look at all of this too before they come to the board for an action item.
Okay, take a look at that.
I'm sure that Laura and the team would appreciate any members who would be willing to lend their support. So yes, please reach out to me or reach out to her if you would be willing to review policy drafts. Thank you, Laura. Any other questions on that topic? Well, we suspected this was going to be a shorter meeting. There is some media content as part of the agenda that I would refer you to take a look at. And are there any other items that need to be brought before the board this morning? Laura, please.
Yeah, I just wanted to mention a couple things about the videos that are linked in your board materials. We've been doing Some Good Education News videos for quite a while, and I wanted to point out this one in particular because it features libraries and what's happening with public libraries. And the Salt Lake County Library System just opened a new Kearns branch, and the technology and the approach for public libraries is just amazing. So it's featured in that video that you have there. I would really encourage you to look at it so you can see what the modern libraries have and the kind of setup and equipment that they're checking out. It's pretty amazing to see.
Thank you. Any other items or questions before the board? Well, our next meeting is scheduled for June 11th. Once again, we're still holding out hope for a board retreat, perhaps this fall, but in-person retreat. But the meeting on June 11th, once again, will be WebEx. And if there's nothing else to come before the board, I will entertain a motion to adjourn. Unless you want to stay.
I can make that motion.
Thank you, Scott. Is there a second?
Second.
Thank you. All in favor, please raise your hand. Any opposed? We are adjourned. You all have a wonderful rest of your day and a wonderful weekend. Thank you for your participation.